Welcome friends. Today we will discuss on cardinal manifestations and presentation of diseases. Now there are different presentation of diseases in human body. One important presentation is alteration in body temperature. Now in next few episodes we will discuss different manifestations, pathogenesis, treatment and other aspects of alterations in body temperature. Now alteration in body temperature we will discuss mainly in 5 episodes. Number 1 is fever, number 2 fever with rash, number 3 fever of unknown origin, number 4 hypothermia, number 5 heat related illness. So these are the 5 important aspects of alteration in body temperature. Today we will discuss on fever. So before entering into fever, let us know what is normal body temperature. Normal body temperature is 36.5 to 37.5 degrees centigrade or 97.7 to 99.5 degree Fahrenheit. So this is normal body temperature. Now over more than 3500 more than 18 years of age adult patients study showed average oral mean temperature is 36.6 degrees centigrade. So range is 36.5 to 37.5 and mean is 36.6. Now when this temperature is rising above 37.7 or 99.9 degree Fahrenheit, it is fever. So elevation of temperature more than 37.7 degree centigrade or 99.9 degree Fahrenheit, this is known as fever. Now before entering into further discussion of fever, let us understand how our normal body temperature is maintained. Now whole body temperature is basically regulated by hypothalamus. Neurons in preoptic anterior and posterior hypothalamus are under control of two signals. One signal is coming from periphery through peripheral nerves from the cold and warm receptors of the skin, and another signal is coming from the temperature of the blood bathing thalamus. Now these two signals are getting integrated to thermoregulatory center situated within hypothalamus and setting a particular temperature to thermostat. Think about your home. Suppose in a home, in a air conditioned machine, what we are doing? We are setting a particular temperature and gradually the ambient temperature is taking that temperature. It is just like that. In thermoregulatory center, body is setting a particular temperature and the whole signaling system then getting activated to set the whole body temperature at par temperature set in the thermoregulatory center. As for example, suppose thermoregulatory center changed its setting from 37 to 39 degrees centigrade. So, immediately what happens? Neurons in the thermoregulatory center is getting activated. So, when it is getting activated, immediately peripheral vasoconstriction starts. So, peripheral vasoconstriction usually starts from hands and palms. Hence, when fever is coming to any patient, usually acral parts of the body like hands and palms are becoming cold. Then what happens? Due to peripheral vasoconstriction, blood is getting shifted from periphery to core, and the internal core temperature is rising 1 to 2 degrees centigrade. At this point of time, shivering starts. What is shivering? Contraction of the muscle. Due to contraction of the muscle, what happens? Temperature started rising. So, this is known as shivering thermogenesis by the contraction of the muscle, increasing metabolic temperature from the muscle, which is contributing to rise in the internal temperature. When it is not adequate enough to rise the temperature as per set in the thermoregulatory set point in hypothalamus, then what happens? Non-shivering thermogenesis starts. And what is non-shivering thermogenesis? That is heat generated by the metabolism in the liver getting increased, and that generates more and more temperature, and the temperature of the internal or core temperature gradually started rising. So, this is known as non-shivering thermogenesis. So, thermogenesis is of two types. One is shivering type, another is non-shivering type. Shivering thermogenesis by the contraction of the muscle, non-shivering thermogenesis by the production of the heat by increased metabolism in the liver. With this, another contributing factor is behavioral adjustment. What happens? When, to start with, peripheral vasoconstriction is there, skin becomes cold and patients are feeling cold. At that time, if we are putting some blankets to the patient, that also prevents dissipation of the temperature from the body, and temperature is getting conserved, and that also contributes to rise temperature. So, to rise temperature there are four contributions. Number one, shifting of blood from periphery by vasoconstriction. Number two, shivering thermogenesis by contraction of the muscle. Number three, non-shivering thermogenesis by increased metabolism in the liver. And number four, by behavioral adjustment like putting some clothes on the patient. By these four processes, what happens? Internal core temperature started rising to the level of the temperature set in the hypothalamus, and at that time the body temperature is getting maintained. After that, suppose we have taken some medicine, some antipyretic medicine to reduce our temperature, or the pyrogens which started the whole process suddenly started decreasing. So, at that point of time, what happens? Again the set point is coming down. Now, when again set point is down regulated to a different set point, so what happens? Now, internal core temperature we need to reduce. So, for that reason, what happens? Heat dissipation now starts. So, for that reason, what happens? Sweating starts, patient started sweating, patient started hyperventilating. So, due to mouth breathing and due to sweating, patient's body temperature started coming down. Number two, peripheral vasodilatation starts. So, blood is getting shifted to the periphery again. Number three, metabolism what increased due in fever, that is again stopped or that is again reduced. So, for that reason temperature production is getting less and patients started taking off their blankets or clothes. So, that is another behavioral adjustment. So, again by reverse process, that is peripheral vasodilatation, stopped shivering thermogenesis, reduced or stopped non-shivering thermogenesis, behavioral adjustment, again internal temperature is coming down. So, basically our thermoregulation is controlled by two processes. One is heat dissipation or heat conservation, another is heat production. Now, heat dissipation is maintained by sweating through skin and through the breathing process, and heat production by two processes. One is shivering, another is non-shivering thermogenesis. Shivering thermogenesis is by the contraction of the muscle, non-shivering thermogenesis is increased metabolic process in the liver producing more heat. So, the whole system is controlled by hypothalamus. So, hypothalamus, neurons activated, heat dissipation or heat conservation and heat production started influenced. So, this is our basic thermoregulatory process. Let us understand what are the factors influencing our body temperature. Daytime and night time, that is diurnal variation of temperature is there, as well as seasonal variation is there. Suppose you are in a very cold area, so your surface temperature will be slightly low. So, number one, ambient temperature is influencing our body. Number two, diurnal and seasonal variation is there. 8 am temperature is always low and in winter it is also low, but 4 pm temperature is usually high and particularly during winter it is also high. So, what I want to mean, there is a diurnal variation, morning temperature is usually low and afternoon temperature will be usually slightly high. Number 3, age. With every 10 years of increasing age, 0.02 degree centigrade reduction of temperature will be there. So, with aging process our temperature is getting low. Next is demographic. There is a demographic influence on thermoregulation, like Afro-American women, they are having slightly higher temperature than white women. So, this is a demographic influence. Now, there is another interesting is reproduction. Now, in any menstruating lady, in pre-ovulatory phase, temperature will be low, and after ovulation, next 2 weeks, temperature will be high by 0.6 degree centigrade or 1 degree Fahrenheit. So, before ovulation, temperature will be slightly low, after ovulation, temperature will be slightly high. Another important contributing factor in thermoregulation of the body is comorbid factors, like cancer patients, they are having 0.02 degree centigrade higher temperature always, like hypothyroid patients who are having 0.01 degree centigrade lower temperature. So, comorbidities are having interesting influencing factor on thermoregulation. So, if we summarize diurnal variation, seasonal variation, age, ambience temperature, demographic factor, body physiology like ovulation and comorbidities, all are influencing our body temperature. We have already discussed what is fever, or rather we have already discussed when we will think of fever, elevation of temperature. We have already discussed what is normal body temperature, basic thermoregulatory process, factors influencing thermoregulation. Now, before entering into further discussion, we must know what are the parts of the body where we can measure body temperature. Now, rectal temperature is one important what we are usually measuring. Another is oral temperature. Now, we have to understand one point. Oral temperature is always 0.4 degree centigrade lower than rectal temperature. Why? Because we are mouth breathing. So, with mouth breathing we are losing our temperature. So, oral temperature is always lower than rectal temperature. Very nearer to our core body temperature is lower esophageal temperature. So, lower esophageal temperature is nearer to the core body temperature. Another is tympanic thermometer. By tympanic thermometer, we can measure temperature in adjusted and unadjusted mode. So, rectal, oral, esophageal and tympanic temperatures we can take into consideration for treatment of fever. So, today up to this we have discussed basic thermoregulatory process to maintain normal internal core temperature, different levels of normal temperature and level of febrile temperature, factors influencing temperature and sites of the body where we can measure our body temperature for clinical purpose. So, dear friends, in next day we will discuss fever versus hyperpyrexia and hyperthermia and pathogenesis of fever. It is very interesting. Stay tuned and we will meet very soon. Thank you.